Dermatomyositis is a connective tissue disease related to polymyositis that is characterized by inflammation of the muscle and the skin. While DM most frequently affects the skin and muscles, it is a systemic disorder that may also affect the joints, esophagus, lungs, and the heart. Epidemiology. It is less common in white patients, appears at any age 5, 15, 45, 65. It has association with connective system disease like lupus, arthritis, and Sjogren. Signs and symptoms. Skin rash and symmetric proximal muscle weakness. It varies from person to person. The Rotten sign, the heliotrope or lilac rash. In the Schall sign, dysphagia and feverish sensation.
Dermatomyositis is a kind of autoimmune disease that affects the skin. It causes inflammation of the skin, so it results in very typical kinds of rash. It can give pink cheeks, almost like a lupus rash looks, and sometimes that pains people. It gives a little bit of a purple hue over the eye limits, and it can give patches of red skin along the elbows, over the knuckles, and on the knees. And then it also affects muscle, so it causes inflammation of muscle. And in the beginning, people may just feel like they have the flu. They're achy, they're tired, they might have some fever. But if somebody notices that very characteristic rash at the same time, it's usually picked up sooner. The rest of it might get picked up because, unlike the flu, it doesn't get better, and people do become progressively weak. They find it difficult to climb up the stairs, to go up the stairs on the school bus, to stand up from a chair. Those are the types of situations that would become difficult.
What's the usual history? What does it happen?
Most patients with dermatomyositis do extremely well. We have much better medications for all of our autoimmune diseases now than we used to. And we know that if we treat it quickly and pretty aggressively in the beginning, we can put people into a quiet state of the illness, and then usually it does not recur after stopping the medication. It's usually about 2 years for the complete treatment of dermatomyositis. And in most cases, it does not recur after. Sometimes it does, and patients need to go back on medicine.
The Rotten sign is an erythematous scald eruption occurring in symmetric fashion over the MCP and interphalangeal joints, and can mimic psoriasis. The heliotrope or lilac sign is vivacious eruption on the upper eyelids and in rare cases on the lower eyelids as well, often with itching and swelling. The shawl or V sign is a diffuse, flat erythematous lesion over the back and shoulders or in a V over the psoriatic neck and back or neck and the upper chest, which worsens with UV light. The case report. A 50-year-old woman with dermatomyositis presented with progressive diffuse subcutaneous nodules on the arms and legs. At the time of the initial diagnosis 3 years earlier, manifestations of dermatomyositis had included an inflammatory myopathy, gutterous papules, and both a heliotrope and photosensitive rash. Treatment with methotrexate and prednisone had resulted in remission of the myopathy, but she continued to have active inflammatory skin disease, and during the past 10 years she had progression of hard, mobile, painless subcutaneous nodules. Serum levels of ionized calcium, phosphorus, and albumin 25-hydroxyvitamin D and intact parathyroid hormone were normal. A radiograph of the left shoulder showed extension of tissue calcification and an old fracture of the cervical neck of the humerus, which was attributed to corticoid treatment. The clinical presentation was consistent with the diagnosis of dermatomyositis-associated calcinosis. The causes is unknown, but it may result from an initial viral or bacterial infection. Even after treatment occurred the infection in cases that follow closely after pregnancy. In some cases, and some research suggests an immune response to lingering fetal cells still circulating in the mother becoming an immune response against the parent, resulting in chronic autoimmune activity. Regardless of the trigger, dermatomyositis may behave as a systemic autoimmune disease. Many people diagnosed with dermatomyositis were previously diagnosed with infectious mononucleosis, Epstein-Barr virus, chlamydia, pneumonitis, psittacosis, and other types of infections. Some cases of dermatomyositis actually overlap with other autoimmune diseases. The treatment, this can be treated with steroids and mild dose of chemotherapy. Specialized exercise therapy may supplement treatment to enhance quality of life. Medications include prednisolone, methotrexate, mycophenolate, hydroxychloroquine, intravenous immunoglobulin, azathioprine, cyclophosphamide, infliximab, and rituximab.
Dermatomyositis is a muscle disease characterized by inflammation and a skin rash. It is a type of inflammatory myopathy. The cause of dermatomyositis is unknown. Experts think it may be due to a viral infection of the muscles or a problem with the body's immune system. It can also sometimes occur in patients who have cancer of the abdomen, lung or other body area. Dermatomyositis symptoms: difficulty swallowing, muscle weakness, stiffness or soreness, purple-violet colored upper eyelids, purple-red skin rash, shortness of breath. Dermatomyositis treatment: the disease is treated with anti-inflammatory medicines, called corticosteroids, and drugs that suppress the immune system. When your muscle strength gets better, your doctor may tell you to slowly cut back on your doses. However, most people with this condition must take a medicine called prednisone indefinitely. If the condition is associated with a tumor, the muscle weakness and rash may improve when the tumor is removed. Dermatomyositis is a common disease, yet every individual needs unique treatment and care. We encourage people with dermatomyositis and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about dermatomyositis and how to treat dermatomyositis, just click on the link at description or visit www.mained.com. Thank
In conclusion, before the advent of modern treatments such as prednisone, intravenous immunoglobulin, plasmapheresis, chemotherapies, and other drugs, the prognosis was poor. Now there are numerous treatments and immunomodulatory drugs. It is important that treatment begin as soon as possible. The cutaneous manifestations of dermatomyositis may or may not improve with therapy in parallel with the improvement of the myositis. In some patients, the weakness and rash resolve together, and in others, the two are not linked, with one or the other being more challenging to control.